Mayor Minto is here, so we can start the meeting.
I'll second that.
Welcome to the June 21st SANDAG Public Safety Committee meeting. Before we start, I would like to ask our interpreter to be introduced and walk us through how to access interpretation services for today's meeting.
Announcement from interpreter. To use the interpretation feature, please scroll to the bottom of the Zoom screen where the meeting controls are. Click on the interpretation icon, which is the world, and select English as your language. If you are joining through the Zoom mobile app, cell phone, tablet, etc., please press the ellipsis, then interpretation, and then choose your language. Finally, click on mute original audio to not hear the original Spanish in the background. Headsets are available for interpretation. If you are in the meeting room, please check out a headset from the receptionist in the lobby. Aviso por parte del intérprete. Para hacer uso del servicio de interpretación, favor de desplazarse a la parte inferior de la pantalla de Zoom, donde aparecen los controles. Haga clic en el icono de interpretación, el globo terráqueo, y seleccione Spanish, español. Si está utilizando la aplicación móvil de Zoom, celular, tableta, etc., presione los puntos suspensivos, luego interpretación y luego el idioma. Si no desea escuchar el audio original en inglés en el fondo, por favor seleccione Mute Original Audio, silenciar audio original. Contamos con auriculares disponibles para el servicio de interpretación. Si se encuentra en la sala de reunión, favor de pedir auriculares con la recepcionista en el vestíbulo. Thank you.
Thank you, Linda. Also want to, actually, before we start, why don't we start with the Pledge of Allegiance? Please join me. Thank you, Mayor. And before we go forward, can we confirm that we have quorum today?
Yes, Chair, we have quorum.
Thank you, Linda. Also want to take this opportunity to welcome our new SANDAG Chief Executive Officer, Mr. Mario Orso. Thank you for coming to our Public Safety Committee meeting. The floor is yours.
Thank you. What a pleasure to be here. Talking to Tony, he was mentioning about the group, how it functions. You know, it's my first week. So, you know, Chief, I heard you the other day on TV and I could really relate to all the vision that you're putting because, you know, it's when you come to a new organization, you have ideas, but you also have to keep it moving, right? And you have to deal with the ongoing situations. So very, very happy, very proud. I'll try to be here as many times as I can, support the efforts that the team is doing. And thank you. Thank you for being welcoming here.
Do we have any questions or I'm just playing. You're going to get a lot of that. No, welcome. We're very excited to have you here in San Diego. And thank you so much for all the great work you've done at Caltrans. We look forward to have you bring that dynamic leadership here for SANDAG. Thank you. Thank you. Now, moving on to our regular agenda, I want to remind everybody of our process on member and public comments and communication. Members can simply raise their hands at any point during the agenda item, and I'll go ahead and call upon you. Members of the public must present a speaker slip to the clerk. For those online, you can simply use the raise hand icon in the Zoom toolbar. And if you're calling into the meeting, please press *9. So moving on to item number 1 in today's agenda is public and member comments regarding any issues that are not on today's agenda. Do we have any comments from the members of the public?
Yes, we have one. Truth, come to the podium, please.
All right, I noticed there's too many men in this room, but Joel, I'm trying to be like you. I got the phone, I got food, it's great. The news has revealed that midazolam sedative is being given to people while under arrest without people's consent. Apparently, this is acceptable according to the county EMS protocols, and yet it's against the Nuremberg Code, similar to the lockdown era nonsense. According to CBS, almost 40% of in-custody deaths since 2013 have been related to sedatives. That's unacceptable, unethical, and unlawful, especially on those suffering from substance abuse. Lawsuits need to happen. Now, regarding all of the increasing electrical vehicle fires, is every fire department in the county investing in one-time use $5,000 fire blankets to stop the toxic hydrogen cyanide fumes coming off of the not-so-green EVs when their lithium batteries combust? And does every fire department have the new $34,000 hoses that allow firefighters to try to out the fires from a further distance, even though lithium batteries are just going to reignite over and over and over again? So it seems like SANDAG has a death wish for the rich and naive who waste their money on buying these toxic things. Thank you.
And we have one member virtual, Blair Beekman.
Hi, Blair Beekman. Thanks for the meeting today. I'm thankful to SANDAG persons. I've learned important lessons about how if we work locally towards openness and accountability, that actually sets a standard towards concepts of open democracy, which is concepts of peace and not war, and simply gives good examples to this country and to the world about best practices and what other places of the world can rely on when they see what we can do at the local level, simply offering our best practices. So good luck with openness and accountability. I learned that here at SANDAG meetings. Thank you. Thank you. The CEO is here. I hope his work that we can continue to do around border issues sets a good example for the world also, and that we can talk about a future of border sharing of ideas. It's that sense that creates safety, and that's how we address the future fears. Obviously there about war, extremism. It's our best practices we do here that offsets that. And
Time has expired. And that concludes public comments.
Thank you. Do we have any committee member comments? So I was planning on mentioning it at the end, but I can mention. You want to say a few words now? Okay. All right. Any committee member comments? No. No further comments. Moving on to consent. Do we have any comments from the members of the public?
Truth, come to the podium, please.
All right, I actually really regret that last meeting I did not take up a full minute to talk about my favorite item, the minutes. When the censorship comes into play with any item, including this item, it's the job of the intelligent speakers to play the game back on the censorer, whether it's about minutes or any other item that comes up. The minutes do not reflect the reality that I suffered under last meeting. They cannot show that I had to cut every speech in half during the meeting instead of relaxing. The minutes cannot show that I was hungry during the meeting about the vision of zero cars fraud. The minutes did not show that I did not take up the full SANDAG 60 seconds allotted. The minutes failed to add in the full depth of the story when I alluded to the main board about how Turkey USA took his censorship cue from Nora and how Nora looked up like, what? If only the minutes at every SANDAG meeting could capture the realities on the ground, they'd be so much more interesting to read and truly worth more than 60 seconds of discussion. Also, the minutes say Scott Wall was at the last meeting. I didn't even know who he was. I still don't. And the minutes say that Turkey Jose was actually late by 3 minutes. Is that why people were given only 1 minute to speak? Was it all Jose's fault?
We have Blair Beekman virtual.
Hi, Blair Beekman. To speak to the meeting minutes that was about the public safety work program and budget for 24 and 25, and for County San Diego Detention Facility Strategic Framework Planning. Again, just to make clear, it's our best practices that we can offer in this next year that sets a tone and sets a pace of what people can understand. And we practice and we offer the very best of ourselves, our best idealism of what we want to work towards, and share that and make it clear with the public, that mitigates the future of violence. And people won't want to be violent. And that's what we need to express in how we work, basically. If we offer our best selves, you don't want to be violent. And that's the goal. And that means we have to practice well and do and offer trust and good things. So good luck how we can do that in the next year. If we can, we have some really great examples how we work with the border issues and such. So good luck in that continued good effort and how we can grow that concept. Thank you.
That concludes public comments.
Thank you. Are there any committee member comments? Questions? If no questions or comments, I would like to entertain a motion to approve consent. Moved by Mayor Minto. Can I get a second?
Second.
Second by Supervisor Anderson. I think this is our only item where we'll be voting. So why don't we do a quick roll call? Just simply raise your hand. Everybody in favor, please raise your hand.
You do that.
We do need a roll. Okay, let's do roll call then.
It's a good practice, though.
Yeah.
South County Chair Rodriguez,
Aye.
East County Vice Chair Minto,
Aye.
North County Coastal is absent, North County Inland, Councilmember Musgrove.
Aye.
City of San Diego, Councilmember Campillo. I'll come back to him. County of San Diego Supervisor Anderson. Regional Fire Emergency Medical Services is absent. San Diego County District Attorney Deputy Chief Holmes. San Diego Sheriff's is absent. County Sheriff Association Seat A, Chief Sadler.
Aye.
County Chief Sheriff's Association Seat B, Chief Hernandez. And San Diego Police Department Chief Wall. And that item passes.
Thank you. Moving on to item number 3, we will have a presentation on the San Diego Regional Crime Statistics in 2023 from our very own Dr. Octavio Rodriguez.
Thank you, Chair. Thank you, members of the committee. My name is Octavio Rodriguez, and as you know me, I'm the Principal Criminal Justice Researcher here at SANDAG, and I'm here to talk about item number 3. SANDAG for many decades has been the main source of information for criminal justice and public safety issues in the region. We generate important resources on crime, victimization, public safety expenditures, and others. And this has helped the community to be more informed and also has helped to shape decision-making and public policy. To 2023 was an important year for crime reporting. As some of you know, we changed the decades-long reporting system, the UCR, Uniform Crime Reporting System, that was introduced by the FBI many decades ago, to the new California or the National Incident-Based Reporting System, or CyberSnipers. This transition was extremely challenging for data collection, for compiling, and also for reporting. Those challenges certainly had made that SANDAG probably take a little longer to generate this year's report. But I didn't want to, because we're still on the final steps for publication, but I didn't want to let this opportunity to at least share with you some of the preliminary findings of this year's report, and in a way show you what our region looked like in terms of crime this year. And by the way, this is just a summary of the big changes from the UCR to the new NIBRS system. Some of you know that it was a really big change that I'm going to be explaining a little further later, without getting into too many detail, of course. But this new NIBRS system changed the way we group and we categorize crimes. Most of you are familiar with a traditional categorization of crimes as violent, property, drugs, etc. This new system, the cyber system, changed to two groups, Group A and Group B, and then to three different categories within the Group A crimes, which is crimes against persons, crimes against property, and crimes against society. Regularly, for example, the crimes against persons or kind of embed some of the crimes that were traditionally under the violent crime category. And we're talking about murder, assaults, sex offenses, etc. And property, of course, that's a little easier, but that includes larcenies, thefts, frauds, robbery, and etc. And finally, crimes against society is a new category, a category that didn't exist under UCR, where the main victim is the society as a whole. That is to say, there is no specific victim to that specific crime, but is the society as a whole. And these include, for example, drug violations, gun violations, prostitution, pornography, etc. So how many and what types of crime occurred in the San Diego region in 2023? We had more than 134,000 crimes, Group A crimes, of which more than half were property crimes, and about 1/4 were considered crimes against persons. As I mentioned, that include some of the violent crime categories. Some of the main findings in this year's report is that crime declined compared to the previous year. In fact, there is right now a national downward trend. The FBI talks about historic declines, mainly in violent crimes and remarkably in homicide. The region specifically saw declines in all three categories: person, society, and property, ranging from 2% to 7%. Now, when we look at crimes specifically, of the almost 33,000 crimes against persons, we can see that 85% of them were assaults. Either simple assaults, those that do not involve a weapon and that involve minor bodily injuries, and aggravated assaults, those that, despite of injuries, involve the use of a weapon or attempt to use of a weapon. So the large majority are assaults. Now, if we look how it changed from the previous year, we can see that despite this modest decrease of 2%, there were some important variations across specific crimes. For example, we saw more aggravated assaults and more intimidations. Just a quick parenthesis here, intimidation has been a complicated crime category or a crime that many people have questions about. Intimidation combines offenses such as threats, stalking, no violent children, cruelty, and others. And these saw an increase of 2% from last year. But most importantly, we saw 22 less murders this year compared to 2022. That is a decrease of 21%. It's remarkable, and it follows the trends that we are seeing nationwide. Still, we have to acknowledge that this year there were 83 victims of homicide, and each homicide is one too many. So when we compare the rates in the 3-year period, and also another parenthesis here, because of the change, the transition to the new system, we only have full year data of 3 years, starting 2021, when the transition started. We cannot compare these numbers to the previously reported UCR numbers that providers or give us a picture from many, many years, because the methodologies are different. So that's why we're presenting here only 3 years worth of data. But looking at rates for by 1,000 population, we saw the largest increases in aggravated assaults, as we saw in the previous slide, and important decreases in sex offenses. Another parenthesis here, it is important to have a lot of caution with sex offenses because, as we know, sex offenses are generally underreported crimes, and so increases or decreases in this crime not necessarily reflect that there were less or more crimes of this nature. So in terms of crimes against property, the largest crimes against property represent the largest crime category, includes 25 crimes, and also, as we saw, has the highest share of crimes this past year. It was about 58%. So 1 in 2 crimes were property in 2023. Of these, we can see that almost half were larcenies and theft offenses. These larcenies and theft offenses include, for example, shoplifting, pocket picking, purse snatching, etc. And on a far second, we see destruction of property, which is largely vandalism offenses. So looking for the changes from previous year, we can see that all crimes decline, and the largest decrease we see in extortion. Now, just a little parenthesis here is, again, is, well, larcenies declined 2% from previous year. But as I mentioned, larcenies include different offenses. And it's just important to highlight that there was an increase in shoplifting, which is considered a larceny. There were 1,250 shopliftings this year that represented a 27% increase from last year. It is, of course, important to remember that shoplifting is one of those crimes that are considered to be well underreported, especially, and this has been pointed out by law enforcement agencies and retail business owners, that starting with Prop 47, the reporting of shopliftings have decreased. So again, when looking rates for property crimes, we see that the largest decreases are in frauds and stolen property. Of course, this is different to actual numbers. This takes into account population, and this is accounting for 1,000 population. Finally, the crimes against society, as I mentioned, a category that didn't exist under the UCR system, and where the society as a whole is defined as the main victim. 4 out of 5 of these crimes are drug-related, either narcotic violations, which include cultivation, distribution, sales of illicit substances, or drug equipment violations, which mean manufacture, sale, possession equipment of equipment that aims to manufacture or consume drugs. And so when we compare it to 2022, we see a slightly different picture with a largest increase in prostitution. We have to be careful, though, with this slide showing 20% increase in prostitution because of the small number of actual crimes. We're talking about 36 more prostitution crime cases this last year. And those were largely due to specific and targeted demand reduction operations by some jurisdictions in the region. And the only other increase that we saw in total number of crimes were drug equipment violations. And when we take into consideration those rates that were large enough for comparison, in terms of rates, we only see an increase in drug equipment, but important decreases in weapon violations that include manufacture, sale, purchase, possession, or use of weapons. So this was a lot of data. So I don't hope you to remember anything, but I want you to take some important takeaways with you. First, remember that we are in a transition period, moving to the UCR, to the cyber category. Remember that right now, because of this transition, the comparison that we can do is limited, just because we have 3 years worth of data, and it's really hard to try to make sense of this phenomena in a historic perspective. But a few things to keep in mind importantly from this year is that we did see less crimes in 2022, that the majority of these crimes, 1 out of 2, were against property. Larcenies are the most common crime in the region. And we saw largest increases prostitution, aggravated assaults, and decreases in extortion. I remind you and members of the public that this data is going to be soon available in our open data portal, but you can also access to get previous year's data and other important information from the Criminal Justice Research Division. That concludes my presentation. If this committee has any questions, I'll be happy to answer. Thank you, Chair. Thank you, Vice Chair, and members of the committee.
Thank you, Dr. Rodriguez. Do we have any comments from the members of the public?
We have Truth, please come to the podium, and one virtual.
This crime reporting system is way off base in its linguistics. It should say crimes involving property, not against property. Property is an inanimate object. It can't report a crime and so cannot be a victim of crime. And the label against society has zero meaning. 58% of the reported crimes involve property. Do you think that's because the state enabled crime with horrible ideas like Prop 47 that allowed up to almost $1,000 in theft, sold on a lie of emptying the jails like that's even a good thing? Will crime stop being enabled if there's a 3 strikes instead? No, that would enable criminals to sell more than $1,000 2 times scot-free. The real fix is to ignore unjust laws and to instead follow the Constitution. The stat only compares the last 3 years when it should be showing a 10-year range, especially because of the lockdown effects in 2020. What even is non-sensual sex offenses? That sexual assault and rape? Why is ARJS giving out data that feels like a censored YouTube video where you can't even say the word dead? With misleading data, timeframes, and new questionable categorization of crimes, this alleged trend downward cannot be taken at face value as far as I see it.
Our next speaker is Blair Beekman.
Hi, Blair Beekman. Thanks a lot for this item. Learning crime statistics can be helpful. Learning domestic violence statistics that SANDAG has reported has been interesting. Domestic violence statistics have gone down a bit, and I'd like to, those are good practices to have those sort of information. I hope it's clear, good information, and thank you for it. Overall, ARJS has been around since 1980. It's been a real interesting process for everyone, I think. I hope it's from that we learn to trust that ARJS can be a process of public oversight, and that can really be questioned its data collection practices, you know, how information is shared. That sort of information has to be worthy of public scrutiny and understanding and best practices, how to develop better practices. Good luck how to do that with ARJS data collection items. Thank you.
That concludes public comments.
Thank you. We had Councilmember Musgrove.
Thank you, Dr. Rodriguez. I'm a little confused. Intimidation, is that like a 422 or a verbal 240 where communicating a threat, or maybe a witness intimidation? That all comes into one. And my thought as you're going through this is we have to have some commonality nationally because crimes are identified differently in different jurisdictions. Is that correct?
Yes, thank you, Council Member. You're right. In the NIBRS catalog, there is a big user catalog of the NIBRS system and specify how to classify and report different crimes. And as you mentioned, intimidation includes, for example, texting, threatening somebody verbally, but also tampering with witnesses, tampering with jurors. Nonviolent, as I think I mentioned, a nonviolent child violence, and bomb threats. I think it's also sometimes included. I don't know if you can correct me if I'm wrong, but I think bomb threats are, for example, included in that large intimidation category.
So we didn't create these fields; they're NIBRS fields, and we have to plug in the crimes as we think most appropriate.
So those fields or those different categories and groupings were created at the national level, and the California incident-based reported system adapted to that system and added some crimes that the national system doesn't track, but for California are important, such as hate crimes. So it's mostly California adapted to the national guidelines and added specific items that were important for California.
Okay, and the last thing I have is truth stole some of my thunder. We have robbery as a property crime.
That is a great observation. We have debated a lot about this item. It used to be considered a violent crime, and now is considered under property. The view is, of course, that it's focused on the actual to what's taken from. It's the important thing is that because this system tracks more than one crime before. The system only reported the highest crime, but now there's a possibility of track many crimes. So when there is a robbery, it can also be for example, an assault or intimidation or others. But it's true, it's a little complicated to come to sense to about this change.
So if I come up to you and threaten you to take your milk money, and I have a knife that's unsheathed, I've committed a property crime robbery, I've intimidated you, and potentially an ag assault.
Correct.
Do they all get categorized that way under the same specific incident?
In one incident, you can get different up to 10 crimes, if I'm not mistaken. Up to 10 crimes can be there in the record for that specific incident.
So there's triggering things. The weapon would then trigger the ag assault during the commission of the property crime robbery. So not for you, doctor, but for the DA, how does that factor in through force or fear? And then with a 487 person, I mean, there's got to be some clear delineation on how you're going to charge based on how the crime reports are written.
Yeah, I think from our perspective, it would fall back to the penal code and what the actual characteristics of the offense would be, and we would make a charging decision based on that. It wouldn't be based on how it would be reported under NIBRS. That's a different category.
But at some point, there has to be a follow-up. If there's a finding of guilt and you found them guilty of this particular crime, are they guilty of all three of those crimes on the reporting system?
Not necessarily, because this doesn't account for convictions. This is just reporting the specific crime incident.
Okay.
But as the district attorney mentioned, it is not. The reporting doesn't influence criminal charges presented in court, and the conviction is solely dependent on the charges that were presented.
Okay, it sounds like a shortcoming to me. It sounds like there's a gap that needs to be bridged. Otherwise, we're looking at multiple databases to get conclusions. If we have a report of somebody that committed 10 crimes when in fact it was one action, but there's no resolution in that database, then you have to go searching around for other resolutions. And you wouldn't know to look for the California Penal Code section because that's not illustrated in NIBRS. Thank you.
Thank you, Councilmember. Additional questions or comments? Mayor Minto?
I'm going to jump on the bandwagon here. I think it's a great report. It's very lacking to probably anybody involved in the criminal justice system, though. Excuse me. I think it's great because California can say how much better they're doing than across the country, because I guarantee if you go to Louisiana, a robbery is a robbery. I don't care what they did to you. They took your money by force or fear. It's still a robbery, but they're probably not going to report it as intimidation or something of that nature. So California has to do that because they've got to show that they have a lower crime rate. I think I brought this up before, just like the reduction of murders. It's probably be nice to know how many of those people were saved by the better prepared paramedics these days. Because 10 years ago, 20 years ago, those people were going to die, and that would have created a higher homicide rate. And, I think it was a great question for the district attorney's office, because you can't rely on any of this information if you're going to, in my opinion, look at any kind of statistics so that you can go forward with prosecution. I don't even know how maybe for the chiefs, how do your coppers actually report any of these crimes? They still do the same thing, 211's to 211, 487's 487. cetera?
Yeah, I'll comment. One of the things that's confusing in this, the robbery, is the other charges involved in that robbery are lesser included offenses. If we wanted to, we could take every crime that's committed and find some type of lesser included offense in it, and we can spread that thing out. So when you look at robbery, it encompasses all that, the taking of property, the threatening and all that. That's why it's called robbery. But if we want to sparse that, we could do that with a vandalism. We could put intimidation in there. We can put a hate crime in there. We can do all kind of stuff with that. So just something to think about.
Yeah, so it's, I don't know if it's just me, but these reports, as far as telling us what's happened, higher, lower, robbery or whatever, well, we don't even have robbery anymore according to this. So they pretty much are worthless. But what I would like to see though, is if we could keep a system where ARGIS tracks like they used to, and maybe we could have a comparison to what the true numbers are versus NIBRs and cybers, because I guarantee they're going to be very different in the community when they find out that there's more crime going on in their community than what is being reported under these conditions. I think they're going to be very annoyed and probably feel like they've been lied to. So I don't know who's making the decisions, you know, for how we report these crimes now. And I know you guys, ARGIS and everybody's doing their job based on what they're told to do, but it's disingenuous in my opinion. And the fact that we have a lot more elected officials in law enforcement, I think they're finding the same thing as very disingenuous, and we should be getting the true numbers. And I mean, unless it's a witness intimidation, there's no such thing as intimidation in my books in the law enforcement world.
Is there somewhere on the ARGIS site where you have what is effectively a cheat sheet so that we could take this back to our cities and discuss with our law enforcement team? Because when we get our stat reports, if we see this, you know, exponential growth of a particular crime that is not, it's not a part one, part two, it's a part B now.
Group A or Group B?
Okay, Group
Yeah.
B. And wondering how come we have so many of these? Well, because we only had a few of those, but they all develop out of those. It's like the Vice Chair said, it's going to cause some concern about why this sudden growth in this area and what happened to this side.
Mhm.
So we need to be able to draw the correlations and almost a side-by-side comparison. What used to be this now incorporates all of these if these factors exist. I
Councilmember.
know it's pretty in-depth, but
Thank you. I think I think it's important to continue to have conversations with SANDAG staff as we are heading into the 2024 statistics, so that some of these issues could be worked out. And I reached out to SANDAG staff personally and asked them for individual presentations at our own city. Is that something that we feel we could accommodate as well?
Yes, of course. Yeah.
Absolutely. So I would definitely encourage you to maybe sit down and prepare so they can have a conversation within your own specific city.
if the Chiefs and Sheriffs Association has briefed on down within the commands, then we could have our local either substation captain or in our case, our contract city captain, if they're versed on that, they could bring it to us. I just want to know that we do have a source.
Absolutely. Yes, Councilmember Campillo.
Thank you, Chair. Thank you for the report. I think that the points made are good ones. I'm curious to know, Vice Chair Minto, it seems murders dropped 21%, aggravated assaults only 7%. So you would imagine that the murders that were prevented by good EMTs would show up as more aggravated assaults. So I don't think that's necessarily what's happening, but over the course of time, that's probably definitely the case over a 20 or 30-year period. This is only 3 years that we're really looking at here because of the new types of categorizations, right? I think what would be helpful for us to understand the broad trend, and I've said this for my city staff too, is the statistical analysis of how much more or less of a standard deviation the expected numbers are, because when something drops, a little bit, that can be caused because people are not reporting something. Maybe people are reporting something more than they used to. There's a lot of noise in the statistics, but if we're looking at something dropping by 20%, you would assume that is the positive impact of law enforcement preventing it or in one way or another. But if it was a drop of 1%, statistics would say that that is right around where we would expect that, because the data is probably broken down over a bell curve, right? So knowing those trends and how much above or below the standard, below the median in the form of a standard deviation, I think would let us be able to tell our constituents we are seeing a dramatic positive impact, as opposed to it dropped 20% this year. It's like, well, maybe 20% when the end value is 5 doesn't mean very much. It might mean one person's life is saved, and that is incredibly valuable. But for us to be able to communicate to our constituents with that granularity is what I'm hearing from my colleagues here. But I want to just give a shout out to new Chief Wall of the San Diego Police Department. I know that the city of San Diego remains the second safest or the largest safe city in all of America, 4.4 violent crimes per 1,000 across the 10 biggest cities in America. Just I know that the statistics that we're doing a good job. So I just want to that little bit of analysis into what can help us communicate to our constituents what's working and what's not.
Thank you, council member. To that point, I just want to point this out really quick. Can we go back to the slides? It was one that mentioned, I don't know what number it was, spike in prostitution. There we go.
Fine.
Yeah, so to the point of Councilmember Campillo, I mean, we do see a dramatic increase, and that could be really attributed to a handful of cities working collaboratively and having sting operations to make sure that we address this issue. And we have our chief, Alex Hernandez here from National City, have been having joint operations with the city of San Diego to make sure that we address this issue. So this is naturally going to look higher as a result, but we need to make sure that we do that to discourage this kind of behavior in the future. Yeah, so just a quick observation. Any other thoughts or comments?
Yes.
Yes.
If I may, just 3 things that maybe can help some of the questions here. One, yes, ARGIS still does keep, we have the ability to track and report on the UCR system, Uniform Crime Reporting, that was in place before NIBRS came in. We have that all the way back to 1980, the information. So that is certainly something that we're not going to stop doing because historically we need to have that. Secondly, the reporting that we're doing, the NIBRS, the National Incident-Based Reporting System, is the DOJ's, the FBI's mandate. They collect crime reports for the entire country. So this is the standard they've asked. This rolled out, I think, in 2020. It's moving across the country. Not everybody is there yet. I think about 75% of the country is starting to do it. So there's a learning curve. There is a national nomenclature standard that people are working, and I think within 3 to 5 years, people will have that down pat. It's going to be a little different as people learn to speak in a different reporting language per se, but we're the NIBRS, and then we have the CYBRS, the California Incident-Based Reporting System. As Dr. Rodriguez said, California has adopted the National Incident-Based Reporting System and added some more crimes. I think it's important for people here to know that all the local law enforcement agencies that provide data, the 11 that provide data to ARGIS, SANDAG ARGIS, ARGIS reports those out to the national. So we have to use this reporting nomenclature in that area. But this is just a reporting nomenclature for the federal government to track crimes. The third point is if a police officer, a deputy sheriff, somebody goes and makes an arrest, and I just looked it up to make sure it's the same way. They have a robbery. Robbery uses force or fear to steal something from somebody else. The officer on the street, the police officer, the deputy sheriff, or the high patrolman, they're going to write a robbery report. That's going to be the primary crime, and then there'll be lesser included offenses. The DA is going to get that robbery report, and they're going to prosecute based on the California Penal Code. Nobody is prosecuting based on the CYBRS or the NIBRS reporting concept. That is a separate national reporting system that we're using. When you go to court, that is based on the California Penal Code. So nothing has changed with the addition in terms of prosecution from the DA with regard to reporting to the federal government, the crimes that we have. What is changing is the way crimes are reported. So yes, there will be variance, and people are going to go from 7 crime types to over 54 different categories of crimes. So you may, for example, and I'm not picking any city, have 7,000 crimes of something under the Uniform Crime Reporting System, and you may have 40,000 crimes based under the cybers because it's revealing information that was never revealed before. There are crimes that may have occurred, but it was not part of the 7 major categories. So it's going to look when your public sees the NIBR Cybers report, the crime has gone through the roof. So what we will do is we'll go back to the open data portal because that is where we have the guides, SANDAG's open data portal on how to look at the crime reporting and what it means. We'll go back and look at our guides and see if we can improve those to make them clearer for the people. Because if you're asking, the professionals are asking these questions, then I imagine the citizens are going to do the same thing too. So Octavian, our 2 groups, the criminal justice from SANDAG and Artis, will get together and see if we can improve those. But it's important to know for the prosecution points of view, cybers is not used for prosecution. It's normal California Penal Code, Labor Code, Health and Safety Code, all the state codes is what the DA uses to charge. It's not based on what's on the NIBRS reporting.
Tony, is it your shop that will do the data entry on NIBRS or is it at the command level?
That would be our, it all comes to Artis and Artis puts it in the Cybers format and then sends it off.
So it'll be consistent then?
Yes.
Okay, thanks.
Thank you. Any additional questions or comments? I have a couple. In terms of the, I mean, this is a regional statistics, right? Do we have the ability as a city to break it down by zip code or by jurisdiction?
So we do have information by jurisdiction. In fact, this is just preliminary as we are preparing the final numbers. In the final numbers, we have aggregated tables where you can see information by major jurisdictions. We do not include information by the zip code, but that's something that it's available under the ARGIS website and in the open data portal. Any user can go and check and try different disaggregations of the data. I think, I'm not sure, and you can correct me if I'm wrong, Tony, but I think you can do zip code, electoral district.
We can at ARGIS, but I can tell you, sir, that if your police agency, national city, your intelligence analyst with the geographic information systems will just take the city crime, overlay the zip codes inside there, and it's almost a cookie cutter to go into that area and then draw the reports from that area. So it's very simple to do. I know your people in the police department know how to do that, but we can do it for you too if they can't.
Thank you. We only have 1 zip code, so it should be easy for the city of National City to draw that information up. But I was thinking more, in other jurisdictions where there's multiple zip codes, right? But I'm glad that information is available for those cities that want a presentation and want as much detail as possible. I also want to highlight, and our chief is here. He can maybe talk a little bit about it. We did receive a $1 million grant to help prevent a lot of the thefts around our community by installing cameras all around our city.
Yeah, thank you. So we received a healthy grant, just shy of $1 million for the organized retail theft crime, and we invested all of that into the flock system. So we have a 3-year plan. In fact, they put up a handful of cameras already, and we're getting hits on those right away. We're going to have a total of 91 cameras in the entire city, and that should really do a great job for us. I know that we had a recent crime where there was a female that was dumped into one of our parks, and we were able to track them down to Chula Vista shortly thereafter. So we were able to take photographs. So we're really excited about it. It should be completed by July 12th. So it's right around the corner, and we'll see how it goes for 3 years.
Thank you again. And I do believe other jurisdictions already have the flock program or are in pace to get it, right?
Yeah, so Chula Vista already is on board. I know the city of San Diego. And one of the things that we were doing with the flock coordinators was to see the overlay between us, the city of San Diego, the city of Chula Vista, to make sure that we have all our points of all the main arterial roadways covered, so we have overlap, and we'll have access to see their data, and they'll see our data as well.
No, thank you. I really want to commend everybody serving in this committee in particular. We all care about public safety, and we want our community to be as safe as possible by utilizing, supporting our officers, supporting our public safety teams, and also investments in infrastructure, as is the flock system. So we are eager to continue to make our city and community safer, and really want to commend all of you for all the hard work. Thank you. So this is any other questions, comments? No? This is an informational item only. So moving on to item number 4, which will also be presented by our own Dr. Rodriguez. He will be talking about the findings from the 2023 Substance Abuse Monitoring Program.
Thank you, Chair. And I was going to move to a different chair just to make the appearance that I was a different person, but I'm not gonna play the stunt. Thank you very much, and thank you very much for your questions. I just want to highlight that SANDAG is such a unique planning organization because you don't see criminal justice information and public safety handled and managed by a planning organization, a metropolitan planning organization, especially having RJs on the one side and Criminal Justice Research Division, which takes that information and analyzes it and put it out there for the public to know, to understand, and maybe to shape policy, as I mentioned earlier. But we also do generate important data that's completely unique. It's generated by us. And it's something that has helped the region to understand a little further and a little deeper the issue of drug use in the region. And I'm talking about the substance abuse monitoring. This is one of such program in the nation that has been able to generate this type of historical information for comparison for the last 37 years that has secured local funds to continue this effort when the funds at the national level expired, and that continues and hopefully will continue to track this information and generate. And in a nutshell, what substance abuse monitoring does is surveys, interviews of local arrestees in San Diego jails, followed by a voluntary drug test, which allows us to understand a little more about the aspects around drug use, but also to tie, in a way, some of those responses to actual indicators of positive or negative for drugs. So this year in 2023, our sample population was 291 adults. We do survey adults and juveniles. This presentation is only for adults. The reason why we don't include juveniles here is because we haven't done drug testing on juveniles since the COVID period. So it is important to make that distinction. This is only adults, to be able to actually present some of the results and positives and negatives for drugs. But of these 291 adult participants, the general profile was something predominantly male, Hispanic with an average age of 36 years old, and being in that situation, being in jail for a violent crime. This, as you can see, still keeps some of the old UCR categories. To track it, it's been, as I mentioned, this is a transition period. So as we move forward with this new cyber system, we have to adapt all of our studies to match the new reporting methodology. But the main finding, or the most important finding of this year, is the high amount of positives for a drug. Also, that females had a second-year increase and surpassed males for the first time in 4 years, sorry, while males saw the second-year decrease on positive for any drug. What is evident is the increase, somewhat sustained increase for the last 2 decades. So that's something to really pay attention to. And so we can put in context that increasing trends with some of the things that have happened in our state, in our region for the past decade. We can see, for example, the important legislation somewhat coincides with some shifts, with some changes with the trend. We can see the Realignment of Prisons Act, the AB 109. That's when we started to see some change. Then Prop 47, that turned some felonies into misdemeanors. And then legalization of marijuana with Prop 64. But most importantly, we see important and dramatic changes during the COVID era, right? The COVID pandemic years. We see very large increases on the one hand for males and then decreases for females, which tells a story of a different reality to 2019 and the previous years. And as we start to move away from the COVID years, we can see some of the trends reverting, but still it's important to highlight the higher levels of positives. We're looking at 72% of all males interviewed and 78% of all females interviewed. So now how drug use is connected to criminal conduct. And we can see that most of the participants, as I mentioned before, are there for violent crimes, but it is more common for those who are there for property crime to test positive for a drug. Confusing, but it is more likely for a person who is in jail for property crime to be positive for either any drug or multiple drugs. Now, there are differences between single drug use and poly drug use. For example, it is more common, the second most common crime to be in jail for a poly drug user is obviously drug-related violations, whereas for single drug users, it is more common to be there for a violent crime. So exploring further the connection between crime and drug use, we can see that from the responses that we got from the study, about 1/3 of the participants said that they have committed a crime to support their drug use. And of those, we can see that the majority was positive for meth, had prior felonies, and had some homelessness history. So we can start to see other societal problems that are tangential to drug use that are also interconnected. It is also very useful to know that there are certain differences between substances, and we can see that from the previous slide when we saw the prevalence of meth users among those who commit a crime to support use. So we can see that there are specific characteristics that differentiate certain substances. For example, marijuana is consistently the most common tried substance, people that have used marijuana, and is the one that is also tried at the youngest age and the one that is believed to be easiest to get. However, meth seems to be the one that is used more frequently and to be used more. 73% of all participants that said that they used meth said that they used it in the previous year, and on average, 19 of the 30 last days. So when we talk about marijuana, it is no coincidence that marijuana is the easiest to get. We have Prop 64, legalized marijuana, and then we have multiple sources where one can purchase marijuana or cannabis. You have medical dispensaries, you have recreational dispensaries, deliveries, and others. But what is important to know is that most marijuana users still have multiple ways to get it. They're not tied to one single way of using it. And one of the things that is really remarkable of this study is that we've seen the still strong black market of marijuana. Buying marijuana in the streets is still the second preferred choice for those who say that they like to get marijuana. We ask why, right? Like we need to know why. And most of them mention that it is because on the one hand, there is no taxes, so it's cheaper. Second, it's more convenient. And third, and this is something that it's really interesting, that they prefer the personal connection they have with the dealer, right? So those are the three main reasons users of marijuana say that on why they prefer buying it on the street. And as we can see, just following very high for those who buy it in multiple ways, just shy of those who buy it on the recreational dispensary, still get it on the streets. Now, meth is considered the drug of choice. It's just below marijuana. Marijuana, of course, is legalized in the United States, in California, not at the federal level. We still track it because of the importance of keeping this historical record. But meth is just under just a few points, a few percentage points below positive testing of marijuana. And a couple of important things is, yes, we did see a slight decrease, just a few percentage points from 2022, but it's still a high concern. And we can still see that increase over the past decade on meth positives. A different story is opiates. Opiates has, a slightly lower incidence among the arrestees in local jails, less than 20% overall. 15% actually, but it's consistent. That trend has been consistent, and but it has been increasing over the last 1 or 2 years, as we can see, very slight increases, but it's still growing. And this is probably, or had to do something with fentanyl. But more about fentanyl later. I just want to point out that interesting. Going back to the topic of poly drug users and single drug users, is that there are interesting combinations for those who test positive for more than one drug. And in this slide, we can see that all those who tested positive for opiates also did for meth. It is not the same the other way around, but this combination, having all of those positive for opiates also tested positive for meth, is something really, really important, something that we should pay attention. But I said that there are increases in opiates, and that probably has something to do with fentanyl. Fentanyl, as we know, is a prescription opiate that has been of a growing concern in the US for the last 10 years. Just to get you an idea, the so-called fentanyl epidemic has taken more than 300,000 lives in the US just in the last decade. And even when we haven't seen those numbers and those same trends in San Diego, as we see, for example, on the East Coast, we did see an increase of those who said that consumed or have tried fentanyl over the last 5 years. And we can see the sharp increase from 2018. Even though there's still a few or a very small number that say that they would buy the drug, a lot of them start to say, 1/3 actually, that they believe that they had fentanyl, even if they didn't want to. So people are consuming fentanyl even without knowing it, or even without knowing that they will. So that is important, and that is very something that's very dangerous that we also should pay attention to. And very close to the topic of fentanyl is overdosing. In our sample, about 2 in every 5 participants said that they have overdosed. And a big portion, 43% of those, was due to fentanyl. So that is something that we have to pay attention to. There are positive things. For example, naloxone, which is an opioid reversal, is key to saving lives. And it is encouraging to see that a lot of people, in fact, 63% of those at least know where they could get naloxone. And in those cases, or those instances where somebody has administered naloxone to another person, it has been either a friend or a family. And also very remarkable, just to highlight the work of the fire and emergency services, who also play an important role in saving lives, providing naloxone when there are opioid overdoses. A final reflection on these interconnections of other societal problems, as I mentioned, is homelessness. 62% of our sample, that is 3 out of every 5 adults that we interviewed, said that at some point they have been homeless. And it is more likely for those who said that they've been homeless to test positive for a drug, 84% of those. For those who tested positive, also, they acknowledged that drugs was the second most common cause for them becoming homeless in the first place. And also that connection with crime and with the criminal justice system, 9 out of 10 of these participants said that they had previous arrests. But also, very importantly, 1 in every 2 also said that they were victims of a crime. So again, a lot of information. Both this report and the previous report, the crime report, are going to be available next month, and so more information is going to be there for you to consult. But some of the things that you can probably take away is, remember that we are seeing lower numbers of meds this year, but still very, very concerning. The use of opiates and fentanyl in particular is also very concerning. But remember that naloxone can save lives, and it is important to keep creating awareness of this. And also do not forget that there are connections among many societal problems: drug use, homelessness, crime. And just remember that the homeless population is a population that needs more attention and more support because have greater needs other than actual housing. There are other big problems and bigger needs that they need. And still, even marijuana is legal, there is still a large black market for it. So thank you for law enforcement agencies to, doing important work of, trying to curb this phenomenon. I know because we work together with some of the local agencies in some Prop 64 programs, trying to track the actions of law enforcement agencies in try to tackle black market of marijuana and cannabis. That concludes my very extensive presentation. I really appreciate for giving me the opportunity to share with you the statistics. Remember that Open Data Portal is going to have these and other important data soon. And with that, I conclude my presentation. Thank you very much.
Thank you, Dr. Rodriguez. I appreciate it. Are there any comments from the members of the public?
Yes, Truth, please come to the podium.
Right, many inmates are on many drugs that anyone can buy on almost any street in America at any time. How come no one's monitoring where those drugs are coming from? Or who's making the drugs, or who's paying for them to be made? And why does SANDAG need a bunch of people's tested urine? That information's for the jail so they can ensure proper medical support, and yet that's not even happening, hence the record inmate deaths. And what's the other research, especially if combined with stats about skin color and crime type? The eugenics era already did this in the early 19th century, and we ended up with a lot of research into justifying sterilizations, lobotomies, and abortions. But if you guys want to confirm that drugs are a major contributor to people being perpetrators of crime, just go outside downtown. That's all you need. And yet cities are not investing in substance abuse treatment facilities, and the state's been pushing harm reintroduction to enable addiction. But I agree with most of the takeaways. They're pretty common sense stuff. For example, housing first means substance abuse treatment never, and people dying of their addictions. But people don't get clean with forced treatment. They have to be ready for change, like SANDAG. Thank you.
And one virtual, Blair Beekman.
Hi, Blair Beekman. Thanks a lot for this item. I was just in the SFA area. They're worried about fentanyl abuse and use and how that is continuing. Thanks for the reporting here today. How are we going to address the future of fentanyl imports? That's starting to make people restless that we're not better addressing it. I know there's issues that we dealt with, ghost gun issues from around the world. In California, we created really important stringent laws and regulations towards large corporations and others who are importing ghost gun materials. Could we do the same sort of things, apply that to fentanyl importation and through Mexico border, I guess, also? Good luck in addressing fentanyl, and overall, thank you for this item.
That concludes public comments.
Thank you. Are there any committee member questions or comments?
I just had one. On page 14, as it relates to the overdosing and naloxone, it said the most common administrators include friends, fire, EMS, and family. Was there any law enforcement tracking in there? Because we administer quite a bit of naloxone, and I would say it would be right there comparable to fire EMS, if not more, because a lot of times we're the first on scene administrating that stuff, and we go through quite a bit of it.
Yeah, and we have that, and it is multiple choice, so people tend to choose the one that is more common to them. But we did see, I just didn't include it there because the number is it's below the top three. Just wanted to include the top three, but we still see a lot of reporting that it was law enforcement who administered naloxone.
Additional comments or questions? No? Well, thank you. This is an informational item only. Thank you so much, Dr. Rodriguez. Our fire departments are a vital part of this community and of every one of our communities to make sure that we have a public safety effort. We're very excited to have the fire share their important work in cities of El Cajon and Carlsbad. This will help let the public know about key improvements in emergency responses, and hopefully it'll help other jurisdictions with best practices. We will now have Chief Koch from Chief Hayward and David Graham. Is that correct? Ordeal, sorry. Presenting today. Take it away.
Good afternoon, Chair Rodriguez and respected members of the committee. My name is Ben Koh. I'm the fire chief for Heartland Fire and Rescue. Now, Heartland Fire and Rescue is a joint powers agreement between the cities of El Cajon, La Mesa, and Lemon Grove Fire Departments. And I'm here to present on a program, a pilot program that we started in El Cajon. It's called El Cajon Community Care. It's unique in the state. It's first in the state of California. It's based on nurse navigation for lower acuity level of calls. And just to provide you with a little bit of a background, what we're seeing is, as a fire department, we are an all-risk organization. About 88% of our calls are EMS calls for service. And then looking at the EMS calls, 30% of those calls that have been triaged or are triageable are low acuity level of calls. That means the calls that don't necessarily need paramedic level of service. What we saw in El Cajon over the past 10 years is that we had 51% calls for service increase, whereas there's only around 2% population increase. And trying to keep up with those increases was a challenge, and trying to add more units to respond to those calls is not necessarily a viable option. We're just running out of resources. We're finding that both between transporting ambulances, first responders, and emergency departments, we're getting just overwhelmed. So this program is a pilot program, and I really have to, have a shout out to City of El Cajon, City Council, who was courageous enough to support this. The concept started with my predecessor, Chief Steve Sweeney, who has since retired. And it is a collaboration between City of El Cajon, Grossman Healthcare District, and the leadership of Grossman Healthcare District, specifically their CEO, Christian Wallace, American Medical Response, and then Heartland Communications Facility Authority. So in March 2022, El Cajon City Council set aside $300,000 to fund one-year pilot program, and it was called El Cajon Community Care. The program provides appropriate level of care to callers seeking medical assistance through the 911 system for non-emergency medical conditions by connecting the caller with a nurse and access to right resources. And that's the most important takeaway for us, is being able to provide the most appropriate level of care, because by doing that, we can get the help that the callers need and also make sure that resources are being used diligently. The program went live January 31st, 2023. And so this is a one-year snapshot. In the first 12 months, El Cajon Community Care has provided nurse navigation to over 580 callers. And 96% of these cases did not required clinically rapid response from first responders. There's 4% of the callers that didn't end up having to go back. And when we started the program off, we started very conservatively because we did not want to take any chances of people who truly need 911 access or help to fall through the cracks. So there are safety measures built into this program. And this is also an opt-in program. This is not an automatic program. The callers have to give consent to opt into this program. And this is kind of a breakdown from the first year of how the calls went. And we did use a methodology a little bit as we're going because, as I mentioned, we are the first program in the state of California, and it is a pilot program. So we're trying to learn from the data that was coming in, how things work, how things didn't work. But the big takeaway for us was there's a couple of takeaways. One of them that I want to point out is the self-care component. The 23% of the callers, after talking to a nurse, they did not require to go to a hospital or any first responder assistance. They're just able to talk to a nurse, and that resolved their challenges. And then the other one is looking at the other options that did not result in a transport to emergency department. Referral to alternate destinations, which would be clinics or I'm trying to think of a couple of places. It's clinics and urgent cares. There's a virtual urgent care component, and then there's also an opportunity to go to the emergency room. However, it's going to be going via non-911 resources. One of the things we wanted to find out as part of the program was to find out why people are using the system. And so about a couple months into it, we started to collect qualitative data. And what we found out was that 47% of the callers perceived that they had a life-threatening emergency. So they didn't necessarily understand what was going on with them. 23% had no other transportation options. 21% did not know other options or could not get an appointment. And 9% thought that they would get seen or treated quicker by accessing 911. So as far as the payer class goes, 33% were Medicare, 31% Medi-Cal, 20% were other, 14% were commercial insurance patients, and 2% were uninsured. So this is very rough estimate, avoided emergency care costs. This is trying to look at the first responder cost, emergency department cost, transportation cost. This information came from our partner agency who was providing the services, and they were estimating that the emergency care costs that were avoided were about $372,000. For us on the fire department side, we believe our cost savings or avoided costs were about $77,000. And last but not least, we're looking at the program. It did promote equity of care across the city by providing services to traditionally underserved communities. And with that, I am open to any questions you might have.
Thank you. Do we have any comments from the members of the public? Or are we going to be?
Yeah, they're going to.
Okay. Why don't we all present and then we'll open it up for questions? Is that okay? Perfect. Mr. Graham.
Thank you very much. I think the theme that you're going to see here today is data-driven decisions. You just heard one presentation on kind of breaking down what the fire department is dealing with right now and recognizing the fact that the vast majority of the calls that we are facing are no longer your traditional fire calls, a lot of medical service calls, a lot of other types of calls. And data-driven decisions are absolutely the most important way to do cost-effective public safety and work in an environment that can be very challenging financially. I'm David Graham. I'm the Chief Innovation Officer for the City of Carlsbad. I also run citywide data services, and with me is Chief Ordili. We're going to talk about Carlsbad's efforts to really build a new system that has helped us to better understand our calls and call systems and more rapidly and more agilely address those. And when I think about the opportunities today, I think about going back in the past when I was a kid. So let's have a little bit of fun here as we open up. I know bit of a long meeting, but when I was a kid, I loved reading comics. I'd read the newspaper cover to cover, probably how I ended up getting into working in local government. And there's a one that I really liked. It was called Closer Than We Think. So the future was going to be these robot warehouses, those cool 1960s Star Trek looking robots. Now that I don't see locally very often, although if you do go to an Amazon warehouse, you basically see robot controlled warehouses, but they don't look as cool as the 60s. They look like Roombas. You think about the Sunray sedan. Now this one's a bit of a challenge. Harnessing the power of the sun to zip around in your vehicle, something very San Diego you'd expect. Now, unfortunately, as much as none of us would like to put another drop of gas in our cars at $5 a gallon, there are some challenges engineering-wise with this particular solution. But if you just go up the street to Balboa Park, you can see that there's solar EV charging. It's effectively the exact same thing as that Sunray sedan, not as cool looking. And if you come to Carlsbad, Aptera has 10,000 orders for something that looks more like a rocket ship than it does a car, but it's a fully 100% solar vehicle that'll be going into the market in the next year or two. Speaking of things taking off, they also had to take on fire. So these were the flying fire engines with pressurized tanks, dynaprops zipping between skyscrapers and putting out the most recent conflagration. Now, that technology I've not seen flying around here in downtown San Diego, but it may not look as cool as what they thought the future was going to be, but clearly we have those same capabilities here today. And even at a more granular level, the use of drones and other types of equipment to be able to really enhance our ability, not just to deal with fires, but to deal with all of the sorts of emergency services that these guys up here have to deal with on a regular basis. So when I begin thinking about that future that is here, sometimes it is a bit boring, but as exciting as it is seeing our folks on the ground, they need support from those of us that do a lot of the data work. And what we found was that there was a lot of information that was available, but it was really locked up inside of our systems. Carlsbad is a part of a group of dispatchers, Northcom Dispatch, and the information that they had was getting to our firefighters and to our emergency staff, but we really couldn't do the level of analysis on it that was necessary to have a more granular and more strategic approach to fire. And so what we ended up working on is a number of different things in connection with them. It really started for us in earnest around COVID-19 when we recognized that although we didn't have a lot of testing in those early days of COVID, if you'll remember, we could actually take CAD data and identify places that had flu-like symptoms. Since the symptoms of COVID-19 were similar to the flu, this was provided to our emergency services so they'd have additional situational awareness on areas where there might be concentrations of COVID prior to us having case data. And once we did begin to get case data through the county, we wanted to push this information out to the public. And so we tracked our case rates and specific interventions that would occur during the lockdown or other things the city did on launching mask campaigns and the like. And you'll see that Carlsbad is the dotted line there. We maintain one of the lowest case rates, if not the lowest case rate of cities of 50,000 or more in the region. This information was pushed out to the public through city managers, updates on a weekly basis, really helping create this connection between the public, their actions, our actions, and hopefully working together to keep our neighbors safe. All of this was possible because we built the data infrastructure and policy to be able to bring this information in. We created a linkage with Northcom, and we also helped them upgrade their systems. So we had a direct and real-time pipeline to our own CAD data that was coming from Northcom Dispatch. Now, those are the sorts of kind of boring things that you have to do to be able to visualize a lot of this information. So you may remember that for quite some time, Carlsbad did not have a lifeguard program. Those red dots up there, those are our lifeguard towers. And it was because of data-driven insights that our fire chief was able to convince the city manager and city council to start a program in a cost-effective way to save lives, and also in many ways reduce the sorts of calls that otherwise would require different types of resources that could be an impact on the department. And while I know that this might be kind of what your common thought is about what a lifeguard's daily duties are, it turns out they're pretty good at data too. Here they are explaining to people from Results for America how they're a part of the data collection process, how that data is used and analyzed, and how that leads to decision-making there on the beach. So from all levels of the organization, we've helped to begin to help the department understand that everybody is a part of this quality collection of data that leads to insights that we can make decisions, whether at the top of the organization or in a particular incident. Decisions that were made on early data with, for example, on the west part of the city, we have a much higher response time. You know, it takes a lot longer, at least did. Why is that? Well, when a train comes running through the middle of the city, it cuts north-south, it's a little bit more difficult to get rigs to the west side, and all of our fire stations at the time were on the east side of the city. That's why fire station number 7 at the former Encinas, or at the Encinas power plant, was put up. And we've seen dramatic reductions in response times because we use that data to say that this allowed us to deal with that significant disparity between the west and the east side of the city. Now, for many of you, that sort of information ends up in a report that every so often is done. Carlsbad did quite a few of them every few years. Very expensive, takes a lot of time, the collection of a lot of data, and that information is put into a lovely looking paper report. That paper report has really crucial data like demand for service, incident activity, workload and unit hour utilization. But this data, by the time the report comes out, is already old. It's already information that has passed its prime, if you will. And so our idea was, how do we take this critical data and be able to, instead of a report every few years, create real-time insights from things like our incident data using computer-aided dispatch information from Northcom. So the challenges of the old way was, it was a snapshot in time. It was very costly to do those reports. Very limited visibility, you're just looking at paper reports, and rigid. You couldn't do anything more than sort of respond and hope a few years later you could see that something might have changed. And so our chief, when I came to the city of Carlsbad, had been to a ESRI conference, which many of you know, that's the big GIS company, and he said, "David, I want one of those." And I was like, okay, let's try it out. And at this point in time, nobody had actually built inside of Esri GIS a system that you're about to see. Now, it wasn't about the data team building this or working with any particular company. We really ideated with the department to co-create, and that's why the chief here has an honorary GIS badge. And it really has elevated the ability for our fire service to be able to respond in a more agile way, a more strategic way to both near-term and long-term issues. And that information, while we pump some of it down to the station level, this is actually county data that is available at all of our fire stations. So we're hoping that our fire personnel are also coming up with insights and helping push that information up to command staff and up to the chiefs. And it's helping us with our annual reporting as well, to be able to be taking that data, collecting it, and instead of a report that takes years to do, we're able to do that on an annual basis with more fresh and data that is helpful for the public. In addition to that, having a system like this helps us also do other types of reporting. So you're probably familiar with the ISO. The ISO requests data from fire departments on a fairly regular basis. And instead of having to go do a special project to pull all that data together and send it up to them, we're able to pull that information a lot more easily. Now, why does this matter? Well, the fire suppression rating and reporting that goes through the ISO actually may lead to lower insurance rates in your particular community. community, and being able to have accurate and timely data has in a system that doesn't require us to take resources out to build a special project just to report on this is something that's been of value. So our department and Assistant Chief Ardili will talk a little bit more about this, has a visualized, data-heavy, data analytic, and very accessible system that we're also using to derive insights that soon will be pushed out to the public through a FHIR dashboard that we're very excited to make public in order to help the public also be able to have the same sort of insights that our department's having. So with that, I'll introduce Chief Ardili.
All right. Good afternoon, Chair and committee members. My name is Nick Ardili. I'm the Assistant Fire Chief for the City of Carlsbad. David's right. I do have my honorary GIS badge now. If you would have asked me about replicated servers and those types of things a couple of years ago, I would have not been able to tell you what they were. That being said, we dove in head first and came up with, I think, something that's really helpful for us and for the public to look at our performance and measure our performance in a meaningful way and make decisions based on some of the data that we're seeing. So I'm going to go through a couple of the tabs that we created. I'm not going to spend too much time going into too much detail, but I want to give you a general overview of what this looks like. So I'll take a few minutes. This first one that we're looking at right here, I get asked the question all the time, well, how many calls do you have in Carlsbad? And I always now ask about 4 more questions afterwards. What do you mean? Calls that just happened in Carlsbad, calls that Carlsbad units responded to. What are you after? Are you after our auto-aid calls? Like, what's the question? And what we're trying to do with this tab is answer some of those. So you can see the geospatial data points there with the polygons, and then you see the bar graphs. The bar graph on the right in the green are all calls that Carlsbad went to. The red is calls that happened in Carlsbad we didn't go to at all based on auto-aid agreements. So we may have agreements with Oceanside or Vista, Encinitas, those agencies around us. It's closest unit concept. So we have calls, and other jurisdictions do as well, that occur in Carlsbad that we don't go to at all. The line graph on the right is kind of giving you an idea of seasonal changes in call demand, and you can see it year over year. The charts and graphs that you're seeing here are really based on demand by hour of the day. So if you look at the left on most of the charts themselves, you'll see that's the hour of the day. So 1 o'clock, 2 o'clock, 3 o'clock, and so on. And really what this is highlighting is the peak demands are typically between 8 and 8. And you can see it visualized in different ways. Next ones that we're looking at here is demand by call type. So you have different types of incidents that occur within your jurisdictions. Most of our jurisdictions have a similar ratio. The majority, I would say 80% range, end up being EMS or medical aids. And then you can see the other metrics for fire, alarms, aid, other rescue, those types of call types. This is a zoomed in view. Really what we're trying to highlight here is any of the data points in the polygons. You can hover over them and that gives you a little bit more information, a little more granular information. So it's really interactive. It's tough to show in a static display here, but it is interactive when you interface with it itself. This one is probably my favorite tab that we have. If you look on the left, you can read some of the components that go into a total response time. You have things like call processing, turnout times, travel time itself, and then dispatch to arrival. And the bar graph itself is showing the number, the count that goes into that. There's an average or our goal time. So if you look at, for instance, the travel, our goal is 4 minutes. The line graph above it that shows the time, 7:35, 7:32, and 7:19 is what we're actually performing at. So not hitting that goal, but the good news is we added resources in 2021, 2022, and you can see that we're trending in the right direction. This here is kind of highlighting where our station locations are and trying to visually show that, yes, those are our station locations, but they travel everywhere within the city and they also travel outside of the city. So you can see where the station locations are and the lines represent where they went. Next set of data here is different ways of visualizing how busy each station area is. So those polygons and all the geospatial dots that fall within those polygons help create some of these graphs. They're stacked bar graphs. They go through each fire station and it can kind of show you what the demand is that occurs within that area. This one's an interesting heat map. It's showing unit hour utilization. Unit hour utilization is how much time a unit spends assigned to an incident, and it's based on a percentage. And it's based on the left is the hour of the day. So it's a percentage by hour of the day. And you can see the darker areas are the areas that there's more volume. This is highlighting our auto aid agreements. I already talked a little bit about the auto aid. This is auto aid given versus received. These are the numbers that just for Carlsbad, aid we're giving and versus aid we're receiving. You can see we're giving a little bit more than we're receiving. In years past, that's been flip-flopped. You can see auto aid working, just looking at it geospatially here. Next one kind of puts it into numbers, and this is another favorite of mine because if you rely on the auto aid system too much and don't put the resources in your own jurisdictions, there's an impact. And that impact you can see here, if you look at the 2023 data and CBD1 and follow that to the right, if the home units responded to that incident, their 90th percentile travel time was 6.02. The auto aid travel time was 8.44, and you can see what the delta is, 2.42. So you can see if we're relying too much on that auto aid, what the impacts could be in response times. So really the meat and potatoes of this is it's all great data, but what do you do with it, right? Are you making decisions on it? What kind of decisions are you able to make? So the reason that this slide is up here is when Tri-City Medical Center had their security challenge and we're not accepting as many emergency patients and pushing them to other facilities. There's an obvious impact to wall times. Those wall times create increased response times because of the availability of resources. So we were able to look at the data, say, okay, can we add some resources as a temporary measure to hedge your bets against increasing our response times because of the wall times, and this platform allowed us to do that, and that's what we did.
So what does this all mean? What this all means is that now we have a system with dynamic visualized data at a significantly lower cost. It would have been impossible for us to do this any other way. Much more visibility and more GIS savvy people in the fire department than ever before. We can take on near-term incidents in a more agile way, like the Tri-City Medical Center cybersecurity incident, and a greater opportunity for insights and collaboration. You saw all those dots outside of the city of Carlsbad that we were responding to through auto aid, and being able to collaborate more closely with our other North County partners. We're able to work that through and support their efforts as well. The fact is, seconds save lives, minutes save lives. The vast majority of our calls don't necessarily require a full rig, lights and sirens. The vast majority of our calls are medical calls, similar to what we heard earlier here. And with this sort of information, we're able to develop both a long-term and near-term strategy that ultimately leads to helping the public and saving lives. So the future is really driven by dynamic data. And our expectation is from here on, we'll be able to deal with the issues, whether large or small, in a much more dynamic way using connected data on a platform that I would say almost all of your agencies have. And if there's any help that we can provide in going down this journey, we're happy to do it. Thank you so much for your time.
Thank you for the insightful presentation. Do we have any comments from the members of the public?
Truth, please come to the podium.
All right, El Cajon community care, non-emergency care calls to decrease EMS responses is very smart. About half of the callers thought they had a real emergency. I'm not sure what's wrong with them, but 23% had no transportation, yet MTS is going to impede service north of El Cajon. Sounds like a dangerous decision for health. And yet I haven't heard SANDAG or any East County rep advocate for more trolley and bus frequencies for their affected residents. Thanks for the 1950s futuristic reference. It was nice to know how every generation after was let down on all the innovative ideas, because drones are basically just cheap toys, not quite as cool as the American-made machine ideas. Worst example I've ever seen for innovation is the COVID heat map, waste of money, and led to many people making backwards decisions about their private health. Fear-mongering and misleading people into a shot that injured and killed many people around the world over a virus that Anthony Fauci admitted had less than a 1% fatality rate. But it's a good thing people in Carlsbad just ignored that nonsense and went about their lives. Maybe in the future there could be an EMS app with health answers for people. There's an idea.
We have one virtual, Blair Beekman.
Hi, thank you. Thank you a lot for this item. I'm really interested how, in the Bay Area, at least, where I'm originally from, now I moved down here, CERT services have proved to be really successful, CERT practices. Emergency preparedness seems to be a good system to organize ourselves and offer best practices. So thank you for this item. San Diego OES, you know, they have quarterly public meetings and their process has been pretty interesting to be a part of and learning about. Thank you how this can connect. Try to connect to Bay Area emergency planning practices. They've been doing awesome work with fire and earthquake preparedness. Really good examples for yourselves. So thanks a lot for your efforts here.
That concludes public comment.
Thank you. And unfortunately, we have lost quorum for the remainder of the meeting, but this was the last presentation. Does anybody have any urging questions or comments? Yes, Mayor Minto.
No, I want to thank you very much for that. I know over in Santee, we've been looking at it very carefully, what you've been doing over there. We've been able to actually hire a, what you call them, a triage nurse or whatever. So I'm sorry, I forgot what the term was. And we also have a navigation nurse coordinator. I think that's what it was called. And we're trying to follow in some good footsteps. And I think that there will be a lot more coordination probably as we go forward, because we have Heartland Communications Facility out there, and we're all part of that. Not necessarily part of Heartland itself, but your organization. But I think that's going to help us all probably provide better service. The thing I thought was great is that you have a reduction in cost. And I think that was a great way. I think that was actually one of the things you're trying to do is reduce costs, because you might be able to put that back into personnel later on. So good job. Thank you.
Thank you.
Thank you all for the very insightful presentation. Very much appreciated. This was our last item, and it's an informational item only. Before we adjourn our meeting, I really want to thank the services of our own Cindy Burke, which will be retiring after 33, I believe, 33 years with us here at SANDAG. I only had the privilege of working with her for about a year, but Mr. Tony Ray knows her rather well.
Sure. I first met Cindy when she was an intern here at SANDAG. I was a young deputy in the early 90s in Santee. She came out and actually interned under Susan Pinnell, who was a nationally recognized researcher, and she did such a good job as an intern. She was hired as a full-time employee and worked her way up to become a senior director to the organization. But in Santee, she did an auto theft project where she interviewed 300 people from a local prison and 300 people from a local jail that had been involved in auto theft, learned how they did what they did, learned their craft, created a report, presented to the people in Santee. And Santee was able to reduce auto thefts by 40% for over 4 years. I would say until the management changed and different people started doing different things. And she was data-driven decision-making before that became cool. I guess I would say that was always been her push, what she wanted to do, try to affect agencies and organizations by using data. She's built a tremendous legacy here at SANDAG with what she's done, has many, many fingers of outreach beyond our county in Southern California, and we're going to miss her greatly. We wish her the absolute best. Her last day will be July 2nd, and we look forward to wishing her goodbye when she goes.
That would be Independence Day for her.
That's Independence Day for her, yes.
So again, thank you so much, Cindy. She could not join us today. She had an emergency, but really want to thank Cindy for her service to our agency and working in public safety for her entire career. So really, thank you so much, Cindy. With that said, we will adjourn to our next Public Safety Committee meeting, which is scheduled on Friday, October 18th at 1 p.m. And we are adjourned at 2:44.